Regarding the differences between Delbert 1 type acute injury and a slip capital femoral emphasis, there are certainly some differences. Number one, history. The child with Delbert 1 would have a clear incidence of the injury, while slip capital femoral epiphysis would have a longer duration of history with a period of limping and ability to implement effectively. There will be no clear-cut acute injury history itself. On stable fractures, the Delpit 1 would be a younger child, while slip capital femoral epiphysis would be a slightly older age child, that is 10 to 12 years of age. Number three, a Delbit 1 type of fracture would be received in bed, while there is a possibility that slip capital femoral epiphysis child would be walking with stick. Then on examination, there will be symptoms or stigmata of the acute injury in Delbit 1, while the slip capital femoral epiphysis, if we ask the patient to flex the hip will go in obligate external rotation, which is called Drenum sign. Number four, there will be radiological differences as well. The changes in the slip capital femoral epiphysis will be quite evident with uh, findings that are Tritowin sign, um, calcification, and metaphyseal blanch of steel signs, which will be not evident in the Delbit 1 type. Regarding the natural history of avascular necrosis in children is different than the avascular necrosis history in adults. The natural history is about 18 months, and then after the problems which are post AVN, the natural history of AVN in children will start with 4 stages. That is, number 1, sclerosis; number 2, fragmentation; number 3, reossification; number 4, remodeling. Noting the fact that the reossification stage does not occur in adult population, and the biological plasticity process does not happen in the adult population itself.